Sir, I will like to talk about drug addiction and alcohol.
Sure, that's a very good idea.
Yes. Sir, many celebrities have openly spoken on it, like Honey Singh and Kapil Sharma.
Yes, childhood trauma is definitely very much prevalent these days because people don't even report it. The sexual abuse of a young girl happening when their parents, even when they come to know, they don't report it because sometimes the person who's doing it is in the family.
Social media also, sir, causes lack of self-image and weight,
Absolutely.
eating disorders.
Yes, yes. So there's a whole plethora of disorders there. People will show you the best built bodies, the sculptured abdomen, the 8 packs abdomen. It's all fake, all fake. So much goes behind that to create that kind of picture, you know. But one starts taking them for real.
हेलो, आज हम डिस्कस करेंगे मेंटल हेल्थ एंड ट्रॉमा के ऊपर और हम ये डिस्कस करेंगे कि हाउ ट्रॉमा अफेक्ट्स योर माइंड एज वेल एज योर फिजिकल बॉडी। हम ये भी डिस्कस करेंगे आज के इस एपिसोड के अंदर कि कैसे मेंटल हेल्थ के बारे में एक सोसाइटल स्टिग्मा है जो विद टाइम कम हुआ है, डिक्रीज हुआ है, एंड स्टिल देयर इज़ अ लॉट ऑफ थिंग्स दैट नीड टू बी इम्प्रूव। एंड हम ट्रॉमा से रिलेटेड जो मेडिकेशंस हैं उनके बारे में जो बातें हैं उस बारे में भी डिस्कस करेंगे। एंड आज हमारे साथ एक बहुत ही स्पेशल गेस्ट है, डॉक्टर विकास जैन, हु इज़ इनटू द फील्ड ऑफ साइकाट्री फॉर पास्ट 30 years. Hello, sir.
Hi, hi, Gaurang.
Thank you very
How are
much
you?
for agreeing to do this.
Oh, anytime. You're most welcome.
Sir, today I want to discuss with you about trauma. What is trauma exactly?
So when we talk of trauma, it can be divided into the physical trauma as well as the psychological trauma. And in psychiatry or in psychological mental well-being or mental health when we talk of, so the physical trauma is also relevant here because physical trauma can lead to a lot of psychological issues depending on the nature, depending on the intensity or the quantum of trauma. And as we know that there are a lot of victims from road traffic accidents and falls and suicide attempters, that's also a trauma, you know.
Yes.
And the people who could save their life, but they attempted it, whether it was by jumping in front of the train or trying to shoot themselves or trying to jump into the river. And when we talk of the psychological trauma, so psychological trauma is very much prevalent, as we know, as our expectations are rising. So there are a lot of issues which are going on. The people leaving their families, then there is a trauma, losing their parents, losing their children to drugs. Then there are people whose divorces are happening, the children are failing in the exam, lot of expectations. The business partners are dissociating because of a lot of jealousy which is going on in society. So there are multiple types of trauma. So trauma is basically can be defined as anything which gives you a pain. Now, pain is a very wide word. Pain can be the physical pain or the psychological pain, but anything which gives pain is a trauma. Yeah.
So, sir, can we say that most of the trauma stems from childhood?
So there are two types of trauma. So something which has been harboring since childhood and can present itself in the adulthood or the adolescence or in teens or early 20s or 30s. So childhood trauma is entirely a different thing. Childhood trauma, like it can be in the form of the single parent, the child seeing the violent parents fighting with each other, the child being bullied at the school, the child being sexually abused or physically abused either at the school or by the parents. And this trauma can sometimes, like we see a lot of girls in their early 20s who have been sexually abused when they were 5 or 6, when they didn't even know what it means, whatever was done with them. So there are multiple types of abuses in the childhood which can stem in the school, in the close relation, inside the house, inside the courtyard by a known person or an unknown person. We see so many news in the day, so many rapes are happening, you know. So childhood trauma can definitely lead to a psychological trauma and psychological, it affects the psychological well-being when person grows up. Either he develops a personality disorder, he or she develops a personality disorder, might become very anxious personality-wise, might become dependent onto the others, might lose her self-esteem completely, might lose confidence, get into depression, anxiety disorders, poor performance in the school, poor performance in the career. not being able to cope up with the people around them, poor peer relationship, you know,
Yes.
and irritable most of the times, even attempting suicide. So this is what childhood trauma means, because the child is not able to process that trauma or whatever has happened, that episode, I would say. But a trauma, when we talk of trauma in adulthood, as I just discussed, there can be multiple things. Sudden financial loss in the business, sudden death of the spouse or one of the parents. If you are too attached to one of the parents and that person dies and you were not mentally prepared, so you could not process that grief. So that also leads to trauma. That also leads to lot of interference with your mental well-being. So that is also equally relevant. Childhood trauma is definitely very much prevalent these days because people don't even report it.
Yes.
And this goes on and on and on. And sometimes, like I just discussed, the sexual abuse of a young girl happening. And I'm surprised to see, because I see so many people, I talk to them, even their parents, even when they come to know, they don't report it. Because sometimes the person who's doing it is in the family.
Most of the cases.
Most of the cases, it's in the family, right?
Yes, sir.
So that is very, very traumatic for the child who is not able to understand what is happening with her, you know, and that goes on and on and on, and definitely develops into a major psychiatric disorder later on in life. Because once you become an adult, sometimes, and there's not been any trauma in the childhood, then you can always process, because you have learned the tricks to process your grief or whatever has happened to you, which is sudden, because you have already developed a personality which may be a well-balanced personality. So that's why we see when there are calamities in the society, like there is an earthquake, there is a tsunami, there is a mass shooting, there is a war, all people, they don't react in the same manner. They react differently because it depends on their personality. It depends on their coping mechanisms. If they are able to cope up better, they don't get affected as much as others get affected. So not everybody who goes through trauma develops depression, but trauma which gives pain, how early we process it, it depends how well you're going to come out of it, how quickly you're going to come out of it. That is the relevance of your coping system in the system.
Sir, we are not able to come out of trauma quickly in childhood.
Yes.
Because, and the events that happen in our childhood shape our personality.
Absolutely.
And it reflects our adult image.
Absolutely.
So,
Absolutely.
sir, forgive my Bollywood references because I watch a lot of movies. And there is a picture. Have you watched Deewar, sir?
Yeah, I have.
In Deewar, sir, Amitabh Bachchan in one scene says that even if I remove the tattoo from my hand, it will not be able to get removed from my mind.
Absolutely.
And heart.
Absolutely.
So, sir, how can a child outgrow his trauma?
So that's a very nice example which you have given, Gaurang, because see, a child's mind is like a raw clay. So whatever is printed on that, that becomes,
Permanent.
that becomes permanent. It becomes permanent, but the people who are living with that child, if they are equally illiterate, uneducated, unaware of how to go about it, then it is very, very bad for the child's development later on. These are the people who might even become anti-social traits, like what happened to Amitabh Bachchan in Deewar. He became an angry young man to revenge that, you know. So there are two projections of it. Either you become Amitabh Bachchan of Deewar, you become angry young man, you start beating, killing, you become a don to project those feelings which you have undergone. So you want to take a revenge from the society, irrespective of whether who was the person who did it, or the people associated with that person, or maybe a whole community or a whole group you want to take revenge with. But the other people who are not able to get that kind of opportunity to understand, to take the revenge, so they become very, very passive. When they become passive, they become very introvert. They become very, very introvert and shy. They are no friends. They are depressed most of the time. They stop studying. They stop going out. So these are the people who are more prone to even attempt suicide or become absolutely hopeless and worthless. This is what they are feeling maybe, you know. And that's why these people need help very rapidly. As soon as we come to know, as soon as parents are ready to bring them to us, as soon as they are able to remove that stigma of going to a psychiatrist from their mind, they can come to us. And we have been helping so many such children who have been being brought to us for these kind of things, who have undergone trauma and these things.
Sir, so majorly what age group of people come to you
So
for
generally,
therapy?
what we are seeing, the most of the boys and girls, they're coming in their teens,
Okay.
right? Because of multiple issues, whether issues is with the coping up at the school, or about choosing a right career, or about the behavior of one of the colleagues, and the new age society, a lot of breakups happening at the age of 15, 16 years, where they feel that everything is gone, nothing can be
Relationship
revived
issues,
now,
yes.
because they don't even understand the meaning of relationship at that age, but for them it is the end of the world, you know. So these are the things. So this is one of the, like, very very common things which we are seeing. Then there are studious students who are very very ambitious, and they are not able to clear some exam. They become very depressed. They also become very hopeless.
Like
They,
we get to see in quota suicides.
absolutely. So lot of things which play a role here, like the expectations of the parents, the expectations of the teachers, and their own expectations, and then ready comparison with their peer group. He scored 462, I scored 461. So I lose the seat, he will get one. So 1 mark, but confidence is 101% down, you know. So everything, everywhere. And see, this social media is actually propagating it too much. You see, people see all kind of reels on Insta, where everybody puts their best foot forward. They will show they're traveling, they are buying, they are very rich, they are enjoying their life. Whatever goes behind that, nobody knows, because that's a fake life which they are seeing. But somebody who's watching those reels starts believing that that is true, and I'm nowhere as compared to them. So unnecessarily an unconscious and conscious comparison starts. And once that comparison starts, you feel you are the most unprivileged
Unlucky.
person in the society. Okay, so there is no point in living again. So this is very very common.
And social media also, sir, causes lack of self-image and weight,
Absolutely.
eating disorders.
Yes, yes. So there's a whole plethora of disorders there. People will show you the best built bodies, the sculptured abdomens, the 8 packs abdomen. It's all fake, all fake. So much goes behind that to create that kind of picture, you know. But one starts taking them for real, and that's how it happens. I'm shopping this bag, which is what, 5 lakhs. Oh, I have a bag which is only 30,000. Oh my God, how will I manage now? You know, so this is very, very common. And I think this is one of the common reasons behind spreading the mental disturbances in the society. You know, people, the comparisons, I would say, expectations, comparisons, because most of the people, they don't have a realistic expectation. They have imagined expectations, what they want, but are they making efforts for that?
People want quick results because of social media.
Absolutely.
Patients have reduced.
Yes, yes, yes. So there is no free lunches, there are no quick money, there are no quick fames, you know, unless you adopt some wrong meanings.
Work is worship.
Yeah, work is worship. Absolutely, Goran.
Sir, also I want to discuss that people think that mental health is not related to physical health. But mental health also causes physical problems, diseases.
Yes, it
So
does.
can you please reflect on that?
Yes, sure. So it is both ways. The physical disorders can cause mental unrest, and mental unrest can cause physical diseases. So let's start one by one. So if we talk of the mental disorders leading to physical disorders, so let me tell you that when we talk of depression, so the major cardinal signs or symptoms of depression are increased appetite or decreased appetite. Both the things can lead to metabolic syndromes. One can become obese, one can become diabetic, one can have high cholesterol levels. Not sleeping or excessively sleeping can lead to a lot of headaches, which are real, high BP, high sugar, and of course, the poor liver and kidney functions, which is very, very common. Otherwise, also, our country is a diabetic capital of the world. But all these things, we have seen that stresses can lead to cardiac diseases, heart diseases, can lead to renal diseases, the liver failures. And it out of stress, you start taking alcohol. Then you go to a liver specialist also. You know?
Yes.
So that's how it is. If you are not able to sleep well, that can lead to the hypertension, which is high blood pressure. It can lead to hair loss. It can lead to blurring of vision, because sleep has got a restorative function. If you are not able to sleep well, the repair work is not done at night. Then whatever toot happens, whatever breakage happens in the daytime, that remains like that, and there is no time to repair that. Plus, the growth hormone is released only during sleep, which repairs your body at night. If you are not able to sleep, there is no growth hormone. Then you are not able to sleep, you are not able to repair yourself. Then you start getting older very quickly. You start losing sheen on your face. You start getting graying of hair. You start having multiple pains, body, calf pains, all those things. So it definitely leads to the physical disorder. While at the same time, if we talk of hypertension and other physical disorder, the cardiac disease, it is a very known fact that as soon as the cardiac disease happens or a heart attack happens, one goes through a bypass surgery, 90% of people out of them, they develop depression later on because they start feeling that my life is over. I cannot run, I cannot jog, I cannot work as much. That is a myth. People, if they are strong enough, if they have a right cardiologist, then cardiologist tells them to resume their activity within 3 weeks. They can go back to whatever they were doing before that. But this is what the perception of people have, and that's how it works. So definitely they are both connected to each other.
Sir, I will like to talk about drug addiction and alcohol.
Sure, that's a very good idea.
Yes. Sir, many celebrities have openly spoken on it, like Honey Singh and Kapil Sharma,
Yes.
who used to deal with alcohol addiction problems.
Yes.
And sir, it is related to stress. And when a person consumes alcohol or take a kind of drug like cannabis, marijuana, so it gives you a temporary relief.
Yes.
So, sir, how?
Not only a relief, a temporary high. A temporary high, which is called euphoria. Now people don't know, because when I ask people, what is euphoria? They tell me it is a sense of well-being. But I tell them the correct definition of euphoria, which comes with drugs, the actual definition is false sense of well-being.
Okay.
False. So this is a false sense. People just remove false words from their mind and they feel it's a sense of well-being. So sense of well-being, which is artificially produced by taking some drugs and which is temporary. And these drugs are ultimately damaging your organs in the system. And most quickly affected organ by the drugs is your brain. Because only brain feels that pleasure. Na? So there are neurons in the brain. Every time you substance that goes inside your system, some of the neurons die. So whether be it cannabis, be it marijuana, hash, weed, whatever name you want to give it, bhang, ganja, charas, or opioid derivatives, like then there is cocaine, which is cocoa derivative, then there are hashish, then there are LSD, then there are MDMA, and so many things, So the good thing is that the people now are getting aware, I believe, as compared to what it used to be 5, 6, 10 years back. People are still using it and they are justifying it also, because somewhere on Google and on media it is written that it is safe or it is non-addictive, which is not true, which is a very, very inadequate information. Very, very inadequate information.
Can it be taken in moderation, like whiskey and all?
So I'm coming to that. So what happens? Why people tell me that it is legal? Is it legal in India? No. And what is the legality part associated with it? So most of the people who are going to see this, I'm sure they will be educated by it, because they don't know that what is legal and what is not. So even in US, even in Thailand, where it is being legalized, people don't realize that it is not THC which is being realized, which is bhang, which is ganja, which is not being realized. What is being realized is, because this plant from which all these substances come, their leaf is called THC, which is trihydroxycannabinoid, which is being sold in India because it is a very cheap thing, and that is highly addictive and that is highly damaging to the brain. What is legalized in US is a substance called CBD, which is cannabinoid oil, which comes from the stem of the plant, not from the leaves, which is non-addictive, which is legalized in India also for therapeutic purposes. So even in US, you get CBD on the prescription of a psychiatrist. In India also it is available on the prescription of a psychiatrist. Wherever I see there is somebody who needs it, I write a prescription, right? But that is being used for chronic pains and lot of emotional disturbances, impulsivity, in highly suicidal patients because it gives their mind a calmness. But people believe that THC and CBD is same because they don't know. What comes from the leaves is different and what comes from the stem is different. You know? So this legal part, which most of the people are unaware of this thing. So they just believe that because it is legal in US, so it is legal here also. And they buy it and they keep on doing it. But we have seen a lot of people who are using lot of marijuana here, joints, for smoking up. They are developing psychotic disorders. They start hallucinating, they start seeing things, they start hearing voices, they start acting on them, become excessively violent at times. They have committed suicides because the voices tell them jump, nothing will happen, and they jump and they die. So this is something which people need to understand, that drugs, substances, psychoactive substances, as they are called, psychoactive substances, psychoactive, because they activate the psychosis in your brain, you know. So that's why.
What kind of chemical is in CBD that it helps give pleasure?
Okay. CBD is not for nasha. CBD is not for addiction. CBD is not for pleasure. Not at all. THC people use as a drug for nasha. That's why it is habit forming. CBD is a therapeutic thing because CBD, that is cannabinoid oil, works on different places in the brain for a different purpose. As I said, it may be a painkiller. It might work on other systems of the brain like hypothalamus, thalamus, where it takes care of the emotional part also, right? THC is purely works on the cortex, the dopamine, where it gives you a pleasure for some time. Then you get addicted to it and you want to have it again and again. Then you need to increase the quantity because you become addicted. The one joint was giving you relief earlier. Now you have to have 3 joints to get that kind of pleasure, then 5, then 6, and then 7, and then you end up in a mental hospital. You know, this is how it works.
Tolerance increases.
Tolerance increases. That is how the addiction occurs. Yeah.
Sir, so I just wanted to ask you about alcohol consumption.
Yes.
And how do you help your patients during withdrawal symptoms? And
Yes.
what kind of measures do you take?
So that's a very good question, Gaurav, because the alcohol is something which people take over a period of years, and one fine day, because of one or two reasons, either their family is quite against now, or they are missing out on the working hours in the office, or they have been caught drinking during the working hours, and they feel humiliated, or their liver has stopped working, they have started vomiting, they are losing weight, they develop some metabolic disorders like diabetes, which is very common in alcoholics. Very, very common because of alcohol, because alcohol contains a lot of sugar. And these are the people who have been drinking quite a lot, they don't exercise, they don't go out, they don't meet people, they meet only with people who can drink with them. You know, that is the common interest. So people come with their own will and we start treating them. So first and foremost part is the counseling, which we give them. They know what happens with alcohol, but we tell them what happens if they don't take alcohol. You know, their body will become better, their liver will recover, they will save money, they will save their family. Many people, the wives, they have left them because of this, the children have left them, they are not able to take care of them, there is no money left. So we rather tell them, it's a negative psychology process. We tell them what happens if you don't take alcohol. The whole world has always been telling them, if you take alcohol, this will happen. We tell them, if you don't take alcohol, this will happen. You know, and they understand it. Yeah, fortunately. And then we start them on the medication and regular counseling sessions every week. So there are multiple withdrawal symptoms. Few people develop psychosis, few people develop delirium, which is an encephalopathy because brain actually starts shrinking if you are chronic alcoholic. Then maybe there are alcoholics who have met with road accidents, they have had head injuries, so they want to leave it now. So then we treat them according to the withdrawal symptoms because every person is different, what quantity they were taking, for how long they were taking, and then we treat them with medicines and we make sure that they don't have any withdrawal symptoms, they're able to sleep well, eat well. The counseling goes on every week. We keep them motivated, we keep on motivating them. Then there is a positive reinforcement phenomenon that they come and we tell them, see, your weight is increasing, your diet is better, your family is happier. So this is what we told them on day one, what will happen if you don't take alcohol. and that keeps on increasing. So that's a vicious circle of positivity. Earlier they were into a vicious circle of negativity, right?
There need to be constant follow-up in this
Absolutely, absolutely. Yes. And they are able to go back to the work. Sometimes we write them a fitness certificate after 6 weeks so that their employers can keep them back on the job. Oh, doctor has seen them and he's off alcohol for 6 weeks. So sometimes they get back their jobs also, they get new jobs also. So this is how it works, right?
Sir, again, I would like to talk about trauma. And there is a research done by a group of scientists on mice or rats, in which it tells us that brain assigns you a social ranking.
Yes.
According to the hierarchy.
Yes.
And in animals also we see that the stronger animal, not always the stronger animal wins, sometimes a weaker animal also wins because of the winning mentality.
Right, right.
So sir, how the brain assigns you a social rank, and that is based on your self-image.
Yes.
And because of that, many times your decisions also are shaped because of this thing. Because you have low self-confidence, you avoid many things and many opportunities in life.
Yes, very true.
So
Very true.
I want to ask you about how the brain assigns you a social rank.
So Gaurang, it depends on your previous experiences of life and the kind of a strata you come from, the kind of family background you come from, how well are you doing in your life? Because this hierarchy or social ranking in your brain, it is not constant. It keeps on changing with time. You know, if you are in a struggler, maybe you are ranked 6, social ranking. If you have already achieved something, maybe you get at 4. If you are CEO of the company, maybe you are at the top. You know, so this social ranking changes according to your own self-esteem. And I believe and I have seen that once your social ranking changes, it keeps you motivated. So this is a very important point which you have raised, that if you go low in social ranking, you lose onto your confidence if you are not a struggler, if you are not a fighter, right? Fighter is a better word for these people. And if you fight and you come your way up, you know, then your social ranking increases, your hierarchy increases, and your self-esteem increases. So everything is directly proportional to each other. You keep on increasing that, you keep on increasing your efforts, you keep on increasing your results, you know. And once you start increasing your results, then you get more motivated to do something more. But this all depends on one's personalities also. So there are people who are satisfied with something less, there are people who are not satisfied with something even higher. Okay. That's why there are 1% people in all over the world who are high achiever, highest achiever. Another 10% who are high achievers. So because their personalities are different as compared to others, everybody gets the same opportunity, lesser or higher, but everybody gets the opportunity. But not everybody is able to cash upon them. Depends on how well you cash upon them, how well you see them, how accurately you encash them, you know. And that way, your confidence, your self-esteem, your execution, your judgment, everything which are called higher mental functions in our science, which is called executive functioning, that needs to be very, very strong. And nobody is born with that kind of executive functioning. It needs to be developed. You need to train yourself, either through your mentor, either through a role model, either through by reading or by practicing, or by understanding and making a plan and executing it on the time. So that's how the social ranking changes. In front of, in the eyes of others also, not only in your own self, but in the eyes of others also. That's how ranking changes.
You are saying that you have to train yourself, self-discipline.
Absolutely.
Because I see in a honey badger also, honey badger, he's very small animal, but he's not afraid of lion or animals twice or thrice.
Actually, yes, because this is what their training is. This is what they train themselves. जो डर गया वो मर गया, right? So there are human beings also like that. So there are people who are doing very, very well despite there not being much opportunities, but they could multiply those opportunities for their own benefit at the right time, maybe at the cost of something else in their life, but ultimately they achieved their aim, what they wanted to. And there are people who got everything, but they could not make anything out of it. So that all depends on your mental makeup and this executive functioning which I am talking of.
Sir, Australia became the first country to legalize MDMA for treating PTSD. And various countries are now thinking about it. that legalizing MDMA and psilocybin for treatment of mental disorders.
Right.
What is your take on that, sir?
So I believe, see, PTSD is more common than we see or we diagnose because trauma is everywhere. PTSD happens in about 6 months later after meeting in a life-threatening situation. Maybe you were involved in a very major road accident. Maybe you were kidnapped and tortured. Maybe somebody close to you was killed in front of you. So all these war veterans, you have seen people dying in war, and you were there part of it, of the team. So all these people, they are prone to develop PTSDs. Now PTSD is something, if we characterize it, so there is a vivid recall, a visual images, everything of those episodes because of which you were disturbed. So that's why we call it post-traumatic stress disorder. Post-traumatic. So 6 months later also you're dreaming about it, you're feeling that, you're thinking that. So all this keeps on happening. So sometimes the ideal treatment for PTSD is not drugs. Ideal treatment for PTSD is CBT sessions, which I'll call cognitive behavior therapy sessions. That those thoughts are coming, those images are coming, how to convert them into non-disturbing thoughts. So they are disturbing, but how to change your cognition, your higher mental function so that you do stop getting stressed because of them. And we do give some medication for if one is depressed, if one is anxious, we do give some medication for that. And as far as the MDMA and other things are concerned, all over the world, so people started using cannabis actually for PTSD when people were not able to sleep or they were screaming at night and they were not able to, they were trying to kill themselves at times. So these are the things like cannabis was started. So be it MDMA, be it cannabis, be it opium, be it opioid, it works on the same place in the brain, you know. But I don't think for taking care of one problem, we introduce another problem into the person. Then after 6 months, we'll talk of how to get rid of MDMA then.
Yes. Correct.
That becomes another trauma, you know.
Yes, sir.
With a lot of cost, expensive things, you know. Yeah.
Sir, many people who come for therapy, they want to do the treatment without taking medications.
Yes,
There is
yes,
a lot
very
of,
true, very true.
Because there is a lot of social stigma around it that there are a lot of side effects like sexual dysfunction,
Right,
weight gain,
right,
nausea.
right.
So specifically in SSRIs,
Yes,
the selective serotonin
yes,
reuptake
yes,
inhibitors.
yes, very true.
So, in which cases you think that it is necessary to assign?
See, I tell you what happens. So there are different conditions. If we talk of a personality disorder, which we don't treat as a psychiatric disorder, we treat as a manufacturing defect, you know. So we start them on therapy sessions depending on their personality because there are multiple therapies which are being done for different personality disorders, CBTs, DBTs, IPRs, and so many other things to name few. Now, there are people who are really stressed, who are losing onto the working days, who are prone to commit suicide, who are prone to become homicidal, to hurt somebody, people who have not slept for 6 days, people who have, so therapy is a definitive treatment, but it's a slow process. You know, somebody who was not able to cope up with his own condition, how will he improve within 1 or 2 sessions with the therapy? You know, that takes time. So there are people, so we have a category of people who require a short-term treatment, who don't, treatment means I'm talking of medicines right now. The people who don't need it, the people who need it for long term. And we definitely tell them, discuss them each and everything on the first meeting itself. And we tell them why it is necessary because we are specialists. We know that whatever is required for whatever duration that we do, you know, that's how it works. So then there are people who say, no, we will not take medicines at all. Then we discuss it with them that why do you say so? Then comes this point what you just said. So SSRI-induced sexual effects and other things, metabolic disorders. So let me tell you the medicines which we are prescribing these days. So I as an expert would not write the same medicine to every patient who comes with depression or with the anxiety or the same diagnosis or a schizophrenia or psychosis. So treatment at our place is custom made. It is tailored according to one's needs, according to one's requirements. And once we know that there are few drugs, that if one is prone for diabetes, this will not be given. One is young male who has just got married, who is actively sexually, we will not give him SSRI. So there are multiple things which are available right now. So it's not only SSRI, it's not only SSRI means serotonin inhibitors, there are serotonin modulators, there are serotonin enhancers also. So we got multiple options now. And if patient says, no, I am feeling very good with this medicine and this is very good and I can wait for side effects, because those side effects are not permanent, they are temporary. The moment you reduce the dose, he's fine, But we always discuss it in first hand that this is possible. Would you like to wait or should we give you another medicine? So we discuss it every time. So we got plenty of options available these days. So it doesn't matter. So treatment is very smooth because these days the medicines, they don't work on you. They work with you. They work with you. That's why we encourage everybody to start their own efforts, and while we start with medicines and therapies.
Okay.
That's how it works.
Sir, do these medicines work by changing the levels of serotonin and dopamine?
Absolutely. Not only serotonin and dopamine, there are multiple other chemicals in the brain. To name a few, there are GABAergic vitamins, there are receptors, then there are norepinephrine chemical, multiple.
Can you please explain some of the positive neurotransmitters that help increase your performance?
No, that is basically serotonin is a happy hormone, dopamine also a happy hormone, and or a neurotransmitter, I would say. So they increase in quantity and you start feeling better, But how to increase them, that is a problem, If you want to increase them just by making a joint and smoking it,
Or scrolling
or
reels.
scrolling reels, then that is very, very bad in long run. So we need to do something which can make them permanently high, rather than taking them here and then bringing them down. Let's make them permanently higher, no? So that comes with the exercises, that comes with the routine, jogging, swimming, cycling, gymming, which I always encourage my patients that I put in a condition that I'll treat you only when you start working out. If you don't work out, I can't treat you because you will not be all right. So I don't leave them with any option. They have to exercise to get better.
Sir, not everyone is privileged enough to go for therapy.
Yes, I know.
And sometimes people who try to cure it by themselves are entered into a loop.
Absolutely. It's a very nice point, Gura.
When they are introspecting their past life,
Absolutely.
they relive the trauma again.
Actually.
So, can you please try and help some people who does not have monetary?
So we got so many platforms in our country which are absolutely free of cost for the people who are not able to. But they need to see that whether it is an expert who is running it, whether they are whatever they are taking, if it is run by government, and the people who are providing the therapy, are they qualified enough to provide that therapy? Are they getting any relief? Are their questions being answered? So there are a lot of platforms which are actually offering the free counselings and free therapies, and few people are like offering it at much lower price depending on what is the patient's requirement. So there are a lot of varieties available everywhere, and I think everybody is getting benefited out of it because there are most of the people, they just want to be heard. Somebody listens to them and they feel relieved. Because they can't discuss with their friends, they feel ashamed, they can't discuss with their friends or their parents because they feel the parents will become judgmental. This is a very common feeling. So that's how it works.
And what is the role of nutrition, meditation?
Oh, quite a lot. So let's understand that all these hormones which we are talking of, serotonin, dopamine, everything, they are being made in the brain, but of course with the help of some nutrition. So there are some happy foods and there are so unhappy foods. So when we talk of happy foods, then there are few foods in vegetarian, non-vegetarian. So we talk of good proteins always, good proteins, and some unconventional food. Unconventional food is those fruits which are seasonal, which are not available around the year, like pear, plum, peaches. Then we always talk of walnuts and almonds, which are very, very good for the brain. Because as with the running time, whereas the people are growing, there are a lot of dementia or Alzheimer disease happening in the world. 10% of the population over 65 are forgetting who they are. Where do they live? Who is living with them? It is their wife or their sister or their daughter. So then if we talk of non-veg, we are talking of fish, We are talking of seafood, which has got multiple nutrients which are responsible for well-being of the brain, which are rather responsible for the regeneration of the neurons which are dying because of pollution, because of stress, because of poor lifestyle, so many things. So there are multiple happy foods.
Sir, I also wanted to discuss with you about paranoid schizophrenia. And actress Praveen Babi, she ended
Yes,
up
yes.
her life because of this disease.
Yes, yes.
So, sir, is it also related to trauma that you are afraid of outside environment?
No. When we talk of schizophrenia, Gaurang, we don't talk of trauma. Schizophrenia is something in which person is not in touch with the reality. So trauma is a real thing. In schizophrenia, trauma may be perceived, unreal, which is not true. So the schizophrenic acts on their impulses or their voices or their thoughts which are not in touch with reality. Yeah, Parveen Babi committed suicide because she felt that she was in love with somebody. Everybody knows who it was. And she also felt that that person was also in love with her, which was not the fact. So she was not living in a real life. And that's why she committed suicide, because maybe one day she realized that this can't happen. So she ended her life.
Sir, there is a lot of social stigma around mental health.
Yes.
And what do you feel that people in our country are now talking about it? And what are the changes that are required in the future?
See, I believe as compared to 25 years back when I started my work, there was a lot of stigma around it. But as the education level is growing, as the people are getting aware about the issues like suicides, like depressions, like loss of working hours, so now people are realizing that this is a real problem and you need to go to a psychiatrist. But the major lacuna what is there is that most of the people, they go to their family doctors, and these family doctors, they don't, I'm sorry to say, but they don't guide them adequately to go to a psychiatrist. They try to treat them, they try to counsel them, though they are not qualified enough to do that, not even to write psychiatric drugs, not even to counsel them, but they keep on doing it. So 6 months, 8 months, 1 year, person is also comfortable that I'm not going to a psychiatrist. Rather they will tell the person, don't go to a psychiatrist. He will give you sleeping pills. Okay? We always tell them, we don't make people sleep. We give them wakefulness. They are already sleeping when they come to us. Their mind is sleeping. We wake them up. So we are not giving sleeping pills, because our treatment these days is very, very advanced. We just, according to the nature of symptoms, what chemical is involved, how much, what is the need, as I just said, we tailor the treatment according to everybody, whosoever comes. So this is an individualized, tailored treatment these days. It's not something which is same to everybody, and we are there to understand, because we believe that it's a psychiatrist or a psychologist only who can understand patient's pain. No other specialty in this world, in medical field, is taught how to feel with the patient, which is called empathy. Empathy is taught and practiced only by psychiatrists and psychologists. So patients are encouraged here, if there is any problem, get in touch with us, any suicidal impulse, call us. So we try to keep on helping them all the time.
It's very tough, sir, because you have to daily listen to.
That is okay, but this is my responsibility towards the society, because once I have opted for this, that is my responsibility. I'm treating somebody, I'm responsible for that person.
So what led you to opt for this profession?
I told you, this is the only field in which I believe that there is an actual doctor-patient interaction. Otherwise, with physicians, you put in a stethoscope, go. With the gastroenterologist, you palpate the abdomen for 4 times, go. How many people, specialists in gastro, cardio, remember their patient's name?
Yes,
No, hardly. Ask a psychiatrist. He knows all his patients, their histories, their families, their names, because we are so much involved with our patients. Okay? So
I just want to ask you one more thing.
Yeah, please.
I am very much intrigued by it that in ZNMD also we got to see that the character used to exercise with the other person to know their mental problem, what is disturbing them. currently. So are there any psychological exercises from which you can get to know about the other person? Or
Absolutely. So we are conducting a lot of psychometric assessments. So there are multiple psychometric assessments in which we can decide whether one is suffering with schizophrenia, depression, anxiety. There are multiple scales and testings. We would even know what patient himself doesn't know. So like unconscious conflicts, the unconscious desires, what is bothering them which we are not able to express because they don't know. So there are a lot of things which we are doing.
Can you tell one exercise, sir, please?
No, because that's a scale and that's a test.
Yes, sir.
So that's a lengthy
Okay.
thing. That's yeah, absolutely.
Sir, thank you so much for sharing your knowledge with us, and I'm sure the viewers also get to learn a lot from this point.
Yeah, I'm sure. They should be aware by now.
Yes, sir. Thank you very much, sir.
You're welcome, Gaurang. Lovely.